as it relates to coding and kind of the changing landscape around coding for different types of visits and new codes for using different technology, how frequently do you see maybe practices that are performing services that they aren't either billing appropriately for, that they should be billing something different or something greater for the work that they're doing, or aren't billing at all because the landscape is constantly changing? And what role does Svast play in kind of identifying those opportunities for practices?
Sure. Great question. And I would say that 100% of the people that and the physicians and practices that come our way are in that, they're in that state. So by the time they call us, they realize something's missing. They just don't know what. So we recently onboarded a practice in Sarasota, Florida, neurology and dermatology practice, and the practice administrator said, I know we're missing revenue, I just don't know where. And I feel like we have a high level of adjustments and we just don't know why. So within 3 months of onboarding that practice, we improved their revenue by 32%. So, wow. And that was directly related to coding. So they were missing, we did a quick chart audit and found that there were items that were documented, not billed for, that they didn't realize they could bill for. There were many missing modifiers, and there were just standard coding errors that they were missing, especially with dermatology. It's quite involved. So that advice, that chart audit, we also did a fee analysis. They hadn't had their fees changed in some time, probably 2 to 3 years. So
leaving money on the table.
Leaving money on the table. And
yeah.
we look at that in 2 ways. We can do an immediate fee analysis, which is, we generally recommend about 1.5 times the Medicare reimbursement rates. But when we're posting payments, we take a second pass at that. So as we're posting payments, if we see a payment come in at the charge, we know it's time to increase for that particular code, because we have a payer that is likely going to pay more, but they're only ever going to reimburse for what you've submitted for. So we take a look and find where the highest payer is. It's usually a commercial payer, and raise the rate accordingly. So there was several thousands of dollars on a monthly basis left on the table with the fee analysis alone. Coding was a huge secondary to that. And then certainly understanding modifiers and how they can augment the services and increase the reimbursements.
Got it. Yeah, that makes sense. It's always, it seems like the same story since the beginning of time in revenue cycle and billing services. It's just hard to stay on top of, and most practices don't have the expertise to do even a simple thing because it's not that simple unless you're an expert in it, to update your fee schedule and make sure that you're capturing kind of the maximum dollars that you can for the services you're providing.
Exactly. We also, what we see often, and especially now in 2021, we had the new updated requirements for evaluation and management coding. And so many practices were defaulting to undercoding for the fear of an audit. And so, advising in that, in that way, in a meaningful way where it was going to impact revenue for them, and providing cheat sheets, if you will. If you hit the top 5 criteria, you will meet the criteria and the level for that particular code. And that was highly beneficial for that same practice that I referenced earlier.